So now let's see some pathology. So let's look at some pathologies of the neck. So this image is of our epiglottis level. And in this level we see that there is a retropharyngeal hematoma with airway compromise. So here we have a hematoma. This is a lesion. And this lesion is compressing to our trachea. So here we have a retropharyngeal hematoma. And because of this hematoma, we have to use an endotracheal tube. So patients have to use endotracheal tube and orogastric tube. And this is an example of epiglottitis. So epiglottis is a process of changing the voice of our speech. Now epiglottitis is a normal thick epiglottis. But this is an abnormal thickened epiglottis. And next one is an example of penetrating neck trauma. There is a bullet in the neck. There is a shotgun pellet. And region of left carotid artery is obscured by a stick artifact from metal pellet. So because of this metal bullet, the artifact comes. And we can see the right carotid artery. So I think this is the artery and this is the vein. This is the right carotid artery and this is the jugular vein. But we cannot see this in the left side because of the bullet artifact. And this is the bone window. In the bone window, we can clearly see the cervical bone and also the bullet and the artifact surrounding the bullet. And this is called the stick artifact. Another pathology is the peritonsillar abscess. So we know that in our neck there is some tonsil or gland. And there will be abscesses with the tonsil or beside the tonsil. So this one is an example of the peritonsillar abscess. And because of this tonsil, there is a big tonsil here. And because of this tonsil, the jugular vein has shifted. But here the pharynx level has shifted. Here we can see the hypodense area. We know what is inside the abscess. There is pus. Infected pus. The density of the pus is less. This is the hypodense abscess with enhancing rim. Deviating airway to patient's right. The abscess with enhancing rim means after the contours are enhanced all around the abscess. And the deviating airway means the path of the patient's breathing has shifted to the right. So this is the example of the same. And the next one is anterior neck abscess possibly arising from a dental infection. So this is one is the soft tissue hypodense abscess with enhancing rim. The left side is normal subcutaneous fat. But on the right side, we see normal fat. The fat is standing fat. The fat is replaced by some pathological tissue. So this one is the normal image. And there is a subcutaneous fat in the anterior part of the mandible. And there is a normal epiglottis. But there is also abscess around the mandible. And there is air. Air is seen in the pathology. So here we see the enhancement near the actual. Here is the pathology. Here is the pathology. Here is the pathology. Here is the pathology. And here we see the air fluid level. And there is a time difference in the abscess. And there is a push with the push. And the next one is the vascular dissection. So this is the normal carotid artery. This is the normal carotid artery. But the traumatic dissection of the carotid artery. This is the traumatic dissection of the carotid artery. And this is the carotid artery. The radius is reduced because of the dissection. And in the both side, thrombosed falls lumens and patent to lumens. We can't see the full lumens. There is thrombosed in the half lumens. And here we see blood clots. This is the carotid artery thrombosis. We can see the right carotid artery. But we can't see the left carotid artery. And this is the right carotid artery seen. But the left carotid artery is thrombosed. So thrombosed means blood clots. And the internal jugular vein occlusion. So here we can see the normal internal jugular vein on the left side. And on the right side we can see the carotid artery. But no jugular vein is seen. Because the jugular vein is occluded or thrombosed. Another example of neck mass. There is a tumor or mass in the neck muscle. And this is heterogeneously enhancing mass relation. There is a mass in the right side of the neck. This is the carotid artery and this is the jugular vein. So the carotid artery is situated in front and behind the jugular vein.